Yet in the day, people, one angry pagan here. I wanted to talk about something that was brought to my attention. I can't believe this wasn't brought to my attention before, to be fair. To a campaign called Save Our Pharmacies. Now, this is being led by AIM, Association of Independent Multiple Pharmacies, and what they're saying is really fucking disturbing. So, I'm looking on their site now, okay, and it's the first thing they say is, we need your help, save our pharmacies. Local pharmacies in England are closing at an alarming rate. The support is needed to keep them open. Pharmacies rely on NHS funding for 90% of their income. Since 2015, pharmacy funding has been cut by 30%. 720 pharmacies have permanently closed in that time. We need our pharmacies. Like, we really do. 1.6 million people a day visit a community pharmacy for medicines or healthcare advice. And that rose largely because of Rishi fucking Sunak. Seriously. If you remember, last year or the year before, I can't remember which one now, it's come out with so much bullshit. He's the one who, I'm pretty sure, tried to push for more, for more people to just go to pharmacies, despite the fact that would cost people and would overload the pharmacies. He was warned about this. Did he listen? No, of course he didn't. For many, community pharmacies are the front door to the NHS, especially now. Pharmacies dispense more than 1 billion prescription items every year in England, as well as dispensing medicines safely. Pharmacy teams provide a whole host of NHS services and healthcare services. This actually shouldn't be down to our pharmacies. It wasn't really that. It wasn't really this way when I was a child during the noughties, the late 90s and early noughties. And I looked. It's not just I'm basing this off my own experience here. But since 2015, as said before, funding for pharmacies in England has been cut in real terms, and I like how they specify that, in real terms, by 30%. More and more pharmacies are under too much pressure and having to close their doors permanently. And Rishi Sunak wants us to use our pharmacies more. Yes. Pharmacies desperately need an immediate increase in funding from the government. Without this, the community pharmacy network will collapse and patients will no longer be able to access the support, medicines or advice they need from pharmacies. Now, this is hilarious. Now, this is insane. It's hilarious coming from the government saying that they want people to use pharmacies more to take the pressure off of doctors, and the pressure hasn't been taken off of doctors, really. They've just put pressure on both more pressure on both pharmacies and the GPs. And what do they want? An immediate injection of funding to shore up the community pharmacy network. After years of funding cuts, hundreds of local pharmacies could soon permanently close. A fully funded pharmacy first service in England. This would allow patients to go straight to their local pharmacist to get support for minor conditions and freeing up GP capacity as they currently do in Scotland and Wales. Now, I might have a bit of an issue with this. At the same time as seeing some value in it. Now, I have an issue because of the point I previously made. However, I will say that that is probably because the government didn't do anything to help the pharmacies. So if I take that caveat, yeah, okay, pharmacy first service in England. I can see that working, but only if the structures are there and the funding is there, which it isn't. Now, I get really fucked off every time I hear Rishi Sunak saying he's put records amounts of funding into the NHS, when it just goes straight through the NHS and into private services for the most part. They have privatised our NHS quite a bit. So the way that they're saying that we can help the Save Our Pharmacies campaign is to either sign the petition, which I have, and I would advise you do. I will be putting the link in the description to this video. Call on government to provide fair funding and protect vital NHS services. I mean, the Tories ain't going to do it. This is probably only it'll probably only take effect under a Labour government. But I think this campaign is damn important. So please, if you have the time and if you have it costs less than a tenner to donate. So if you can, please do. If you can't, spread the word, please. The next point they make to try and help them is to email your MP. Write into your MP. Either way. Call into your MP. Whichever way you find easiest. Physically accost them in the street. Encourage your local MP to support fair funding for pharmacies. Bug the fuck out of them. Please. Everyone. Tweet your support using the hashtag #SaveOurPharmacies. Now, I do have a Twitter account, or X account, whatever it is. I'm just not on there because it's just vile, pretty much. But if you are on Twitter, and you do have a presence on Twitter, please, 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 I beg of you, ich beckons through, please, tweet this link all over Twitter, all over Facebook, all over anywhere that you can do. You can bring this up. Please do this. And get the twibbon. I don't know what that is. Support the campaign by adding a label to your profile picture on Twitter, I suppose. This is disgusting. I'm actually almost speechless at this point of how angry I am that our healthcare service, our healthcare public service, has been so gutted because Tories think the state funding public service is a bad thing, despite the fact that half of them wouldn't be alive without it. Now, it says here, just as a, just to bring it home, the CTA, Company Chemists Association, is the trade association for large pharmacy operators in England, Alba and Gymru, England, Scotland and Wales. The CCA has 8 members: Asda, Boots, Lloyd's Pharmacy, Morrison's, Rowland's Pharmacy, Superdrug, Tesco and Well, who between them own and operate nearly 5,500 pharmacies. almost half of the market. Then you have the National Pharmacy Association, apparently popular today. The National Pharmacy Association, the NPA, which is the representative voice of independent community pharmacies across the UK and a leading provider of services to the entire sector. Our aim is to support independent community pharmacies to succeed professionally and commercially for the benefit of their patients. Now, being a socialist, I just prefer the just to get it done. Commercially, yeah, I suppose, for the benefit of their patients. This is this as a not-for-profit organisation, so they don't get any profit for it. We are committed to reinvesting in service provision. So what they want is the state to put funding in to invest. Now, which of the major parties has been talking most about investment? That's right, Labour Party. Now we have the PSNC, the Pharmaceutical Services Negotiating Committee, soon to be renamed Community Pharmacy England. Represents the owners of all 11,000 plus NHS community / high street pharmacies in England. We negotiate with the Department of Health and Social Care, DHSC, and with NHS England on behalf of those pharmacy owners. Now, if you go onto their website, they have the contact. I'm not going to publish the details out here, but if you go onto the, as I said, I will put the link to their website down in the description. They have their contact. The names and contacts are on here. If you want to get hold of them, do so. To ask about this, please do so. Now, again, I'm shocked that I haven't heard about this before. Like, seriously shocked. Reason being is it's been in the media. 14th of March last year. Sorry, we'll go back further than that, actually. Oh dear. So, what we got here? So we'll go back all the way to 2022. 16th of December, pharmacy bodies write to Health and Social Care Secretary warning that pharmacies in England are at a fork in the road and calling for immediate investment. The 23rd of the same month of the same year, the Telegraph and the Times, the Torygraph and the Times, report on an open letter to the Health Secretary which warns the pharmacies are in danger of collapse. 11th of January 2023. The Mirror reports that pharmacies are suffering an annual shortfall of more than £67,000 per pharmacy as government funding for the sector has failed to keep up pace with economic growth. What economic growth? But okay. It's ridiculous. I can't believe I didn't hear about this before. On the 16th of January of last year, pharmacy bodies write to the Prime Minister this time, calling for urgent action to avert further permanent pharmacy. So by this point, by the 16th of January 2023, pharmacies had already started permanently closing and going into commission. So yeah, they're calling on the 16th. They called for the Prime Minister, calling for urgent action to avert further permanent pharmacy closures and commission a pharmacy first service, which he says he did, but didn't add the funding. Not properly, which is why they're still closing. 18th, so 2 days later, pharmacy bodies launched a joint hashtag Save Our Pharmacies campaign, which calls for pharmacy first service for England and fair funding for pharmacies. So the campaign was started on the 18th of last year after they could not get a valid response from the Tory government or even the Prime Minister. 21st of January last year, so again, only 3 days later, the Express reports that pharmacies are closing for good as their funding falls short amid soaring costs. And 10 days later, the Daily Mail, reports on an open letter to the Prime Minister which pleads for urgent action. So it took them 2 weeks to report on the open letter that the campaign had sent to the Prime Minister on the 16th. Then we get to the 20th of February. The Daily Mail again reports that over 1,000 pharmacies and GP practices have closed since 2015. So this isn't just pharmacies, it's GP practices. And this bullshit that he's coming up with about the hubs. If they were doing any work, if they were actually working, if they had the proper funding, then we'd be seeing a difference by now. We're not. A day later, again, the Daily Mail reports on a recent cross-party MP letter to the Secretary of State for Health, which was facilitated by a national pharmacy body. The letter raised growing concerns about the pressures facing England's community pharmacies and the risks this poses to patient care and safety. Then, on the 13th of March, the Daily Express reports on efforts of both national pharmacy bodies and MPs who are demanding urgent access to resolve the funding crisis in the pharmacy sector. This includes an MP letter to the Prime Minister coordinated by an all-party pharmacy group, APPG, and a new public petition. The 14th of March, the Daily Mail reports on the current situation affecting community pharmacies and MPs, peers and the national pharmacy organisations that are calling on the government to rescue this sector from financial disaster. And then it was dropped. The government came out with this thing, which is crap, by the way. It's absolute bullshit. And so the media thought it would just be good to stop talking about it. That's despicable. I cannot believe that I look at that, now I can believe why I missed it. I actually can, because it's been like since early last year. This is something that's been covered up by the Tory-friendly media. And I don't understand. See, it's all from... It all, like, stops last year. And yet I'm still being asked over Yule to push this, please. And fucking right, I'm going to. Now, it says here, I mean, last year the petition had reached 30,000 signatures. I am one of those who I mean, 30,000. They're up to nearly 90,000 of 100,000 signatures. Please sign the petition. Now, this has been a bit of a rough video. I've had a rough couple of weeks. I say couple of weeks, a rough couple of months. So I've not been able to do much. So I've been out of practice with this, with recording. But I feel this is way too important not to do a video on. Please, even if you can't sign and donate and sign to the petition, please spread this like a virus across social media. Please. I've had enough of failing public services. I really have. This is one angry pagan, Siadawita. Good day, people. Blessed Thursday.